Hello everyone. In today's video, let us learn about ADHD, its causes and treatment. You know, ADHD is nothing but attention deficit hyperactive disorder. So normally you can see some children who are very inattentive in the class and they show more amount of inactiveness and they are more sensitive towards the classroom situation. So such children are said to be attention deficit hyperactive children. When you look at this disorder is more commonly found among the children in the school ages. It is easily identified during the school ages itself. The children are affected by this particular attention deficit hyperactive disorder. When you look into some children, they disturb the class very much. They can't sit in a place, they always wander, and they don't have the patience to listen to what the teacher says in the class. So such kind of children can be identified to show the symptoms of ADHD. ADHD is nothing but a medical condition. So they have a difference in their brain development and the activity of the brain mainly. They are not able to pay attention to the things and they can't able to still in a place and they lose their self-control. ADHD affects the children at school, home and even in wherever the place where they are there. It is one of the most commonly diagnosed behavioral disorders found among the childhood days. When we look into the number of children, 3 out of 7 of every 100 school age children are affected by this particular ADHD symptoms. What are the characteristics of this? It is very quite chronic. We can say we cannot cure ADHD, but we can reduce its impact. It may be causing cognitive difficulty in the child to learn in the school and to work in future also. It is not caused only by their genetic alone, but sometimes due to some other reasons also ADHD is occurring in the children. Now let us see what are the 3 major types of ADHD. Predominantly inattentive. This is the first category where they do not show any attentiveness to the things which are going around them. And the second one is predominantly hyperactive. They will not sit in a place. You can see they will always be roaming. They will move around the class, disturb everybody in the classroom, everything. And then the third was combined of both predominantly inactive, hyperactive and insensitivity to the things around them. Okay. Next, let us see how to identify the ADHD children. So when you can see that what are the symptoms? Normally ADHD can be identified with the 3 major symptoms, namely inattention, hyperactivity and impulsivity. Inattention is nothing but the child doesn't gives attention to the details. They make careless mistakes in doing the homework, class work, everything. They have a difficulty in keeping their attention towards a particular thing or a task. If you make them to sit to work or learn something, immediately they will shift on to the other activity. And they spoke also. When they speak, they don't listen to who is speaking to them. They have difficulty in organizing the task and various activity, and they are easily distracted by any even small stimulus that comes from the environment. Okay. Now let us see what are the symptoms of hypersense activity. You can see they have difficulty in their motor coordination. They have fidgets with the hands and and they can't sit in a place. They will be always shivering or they will be having nervousness and sitting inside the classroom and other situation. They have a difficulty in playing and they don't enjoy themselves in the leisure activities. They always change their activities more often. One time you can see them playing with a game, the next time they will be going for some other task or a drawing or some other thing. Immediately for 5 minutes they will be they will not more than 5 minutes they will be engaged in a particular activity, and they talk too much, and they often run, jump and climb when wherever it is not permitted. You can see these children disturbing the class a lot. And then symptoms of impulsivity, you can see they often burst out the answer before you ask them some questions. They will be coming out with their answers, and they don't have the habit of waiting for the others to finish their thing, and let them wait for their turn and all. Okay. And they often interrupt or intrude others when they talk, and they also fight, and more often they are involved in conversations, and they can't wait for the things, and they burst out with their emotions. Okay. Such kind of characteristics shows that they are having ADHD symptoms. You can see now what are the causes of ADHD. It is due to a change in their brain structure. Maybe the structure of the brain is modified a little, and the brain development is affected in that particular child. It might be due to genetic or hereditary causes, and sometimes the mother is exposed to various types of chemicals during their pregnancy, and they would have taken alcohol, drugs, or smoking. They would have had the habit of smoking. That also affect the brain development of the child, and the child is exposed to chemicals at a very young stage itself, from the environmental toxins like lead, chromium and other thing. And if we can see this ADHD is more common, and it is more 3 times more among the boys when compared with the girls. Let us look at the treatment for ADHD. First, we have to educate the child and also their family members. We have to provide them psychological counseling and interventions. We can provide them some drug and natural remedies as medicines for them to cure. What are the other ways we can support children with ADHD is that you have to provide them structure and consistency. You have to make them clear what is their difficulty, and you have to give them clear instruction, only one instruction at a time. And you can't instruct them all of a sudden all together, is it not? So you have to provide one instruction at a time, make them clear, and then go with the next one. And you have to provide them a calm and peaceful environment for learning, and we have to give them ample amount of opportunity for the child to change their mood and other thing. We have to have a very good communication with them so that they are consistently improving in their attitude. We have to offer them love and support so it meets expectations that they have in their life, and understand that ADHD is very hard for the child to control, and they are going to have, and we have to treat them with patience and guidance. Every day we have to be with them, and every moment we have to have a patient look over with their activities. Let us see what are the tips a teacher can have it in her mind when she handles any ADHD children. You have to place them in a proper seating arrangement, provide them, and you have to provide them proper role models. You can use a peer tutoring and a collaborative and a cooperative learning so that they learn the things in a very easy way. And we have to allow them to show their creativity, and have to have a main we have to be very clear and concise instructions have to be given. They should have simplicity, and they should provide a positive guidance to the children. So when you provide them with all these tips, we can educate any ADHD child in a normal classroom itself, and we can have a inclusive classroom environment through this. Okay, I hope you're clear with what is ADHD and what are its causes and symptoms. Thank you.